In this video, we will talk about research and patient-oriented research. There are many different definitions for research. This one defines research as a process of steps used to collect and analyze information to increase the understanding of a topic or an issue. There are two main types of research. The first is basic research. Its goal is to advance fundamental knowledge about the world. The second type is applied research, which focuses more on analyzing and solving real-life problems. Patient-oriented research falls under applied research. Research is a rigorous examination and explanation of the world around us. It is systematic, transparent, explicit, and reproducible. When presenting completed research, it is important to report exactly what was done and how, what did and did not work. This way, the study can be reproduced in the future by other researchers. The stereotypical image of research is that it is done by people wearing white coats in laboratories with microscopes. While this is true for basic research, it is not true of all research. Often, to answer a question, researchers will be required to go into communities and study populations in their context, observing and speaking with them. Also, a lot of research happens partially or exclusively in the library or online. In these cases, researchers study publications that report previous studies on a given topic. So what is patient-oriented research? The Canadian Institutes of Health Research define it as research that engages patients, including their caregivers and families, managers, and clinicians as research partners in the research process. And by engaging them, the research focus is placed on patient priorities and is expected to improve patient outcomes. But working together requires that they understand each other, which is the reason for this research literacy initiative. While research topics can vary, the steps of a research project are common. Researchers and research partners start with an idea, which then becomes a question. Next, they turn to existing publications to see what is already known and if more knowledge is needed. If that's the case, they write a research protocol. The protocol describes the methods that will be used to answer the question. The protocol is then submitted to a research ethics committee, and once approved, the research team can start to collect and analyze data and then draw and disseminate conclusions. You can find more information on research literacy on our website, Understanding Research. This initiative is a work in progress, and we want to hear from you about how to make it better. Thank you for your time and interest.